We also have these uncategorized ADLs. It is a section of the note where you are expected to write a free text description of the status or condition of the patient. Our agency's policy, all these uncategorized ADLs should have a free text on each item describing them. First one is the active or passive exercises. I already wrote this short example here. Range of motion actively for 10 reps. Then always make sure to hit save on the upper right corner. Next is the activities. Example, shopping, games, TV, concerts, bingo. And I also have a short example here. Client played bingo with her son. You can add the date on what time. There you go. Then save. Third is the blood pressure if it's taken, the bowel movement. Make sure to document the last BM, for example, 6/11/2020. The size, small, the color, brown, and the consistency. Then hit save. Next is the medication compliance. Is the patient compliant? Yes or no? And then elaborate, especially if the patient is not compliant with his or her medication. Next one is the mood. Is the client gloomy, irritable, tense, calm, pleasant, or cheerful? Then proceed to nutrition. How is the patient's food intake? Is he or she able to finish a serving? How's the appetite? Then, physical appearance. Is the client unkempt or presentable? For the pulse rate and temperature, if it is taken. And lastly, for the urine output, its color and its odor. Remember, only patients requiring vital signs monitoring are required to have these vital signs filled out. Otherwise, just write NA as a free text. Then make sure to hit save to close the ADL window. Lastly, here you have your notes option for your free text documentation of your care notes. I already written a example here. You can use this section for any other pertinent information during the stay. You don't have to repeat what you have written in here, but only include what you may want to include in your documentation. Some caregivers prefer to write in chronological order or by timestamps like what I did, and this is the perfect part of the note to do so. Hit save again to close the notes window. And there you have it. You have finished your ADL and care notes documentation. Thank you.